right, we're here today with my patient who has osteoarthritis in the knee with moderate pain of 5 out of 10. Today we're going to apply E-stem biphasic pulse current TENS. And so what this is going to do, it's going to just activate the A beta nerves and prevent nociceptive response, known as the gate theory. Some contraindications: we don't want to place the pads near the eyes, near the carotid sinus. If there's a wound, avoid that. If the patient has a pacemaker, we avoid that area. If the patient is pregnant, we avoid that local area. And we also want to make sure that the patient is cognitive and aware, and also that they have sensation of the area we're applying the E-stem to. We already did a dermatome test, so we know she has sensation of her knee where we're applying it. And we also know she isn't at risk of thrombosis, which is also another contraindication. So what we're going to do today is we're going to place these pads on your knee, and it's a really comfortable like tingle, and it's just going to lower your pain by blocking the pain signal to your brain, and it's going to make it feel should make it feel very good.
Okay.
Does that sound like something you want to do today?
Yeah.
Okay, sweet. Is it all right if I touch your knee?
Mm-hmm.
Okay. So I'm going to place the pads on either side of the knee, right where the pain is. All right. And so how I set this up is I make it biphasic. I'm going to leave it at 10 minutes, but normally it's going to be at 30 minutes for a treatment. The rate, I'm going to have that at 80 pulses per second. And the width is going to be at 50 microseconds. And that is going to allow us to activate those A beta nerves. And since she's a smaller person, I feel like that is going to be adequate to activate those nerves. But if we need more, we can also increase that. I'm going to make sure this is continuous, so the E-stem is on during the whole time. And then the amplitude is just going to be a comfortable tingle, a strong tingle for the patient. Okay, so I'm going to start increasing this. This should be very comfortable, like I said, and we describe it as a strong tingle. So you just let me know when you'd like me to stop, okay?
Okay.
When you start feeling it, just tell me, and then I'll start to go slower.
Okay. I'm starting to feel it a little bit.
I'll go slower here, and you just tell me when it feels strong tingle.
You can keep going. Okay, right there.
Right there?
Mm-hmm.
Okay. I'm gonna let that run for just 30 seconds for the video, just to make sure the patient feels good throughout the whole thing. And how is that doing right there?
It's good.
Good?
Good.
Just relaxing, feels good for the
Mm-hmm.
osteoarthritis? Good. Let it go a little bit longer for you. And if she's having pain in both knees, we can apply to both sides too. But right now she's just having pain in her right. Okay, I'm gonna stop it there and remove the pads. All right, and I can observe the skin now and make sure that it's no irritation, it's not red. It looks very good, so I'm happy about that. And so how did that whole thing feel? Is it something you want to do again in the future?
Yeah, it felt really good.
Okay, sweet. So we can continue to do this when her pain flares up, and also at the end of treatments, just for the pain to make it feel good.